Polycystic Ovary Syndrome, sometimes known as PCOS, may have affected you or someone you know. The term Polycystic Ovarian Syndrome is deceptive since it implies that the disease is mostly with the ovaries and that you may have numerous cysts on them. The etiology of PCOS, however, is hormonal. It is not a condition that only affects the ovaries as the name suggests. So what is PCOS all about, and how does one heal from it? Hey, and welcome to another amazing video. What is the impact of this condition, and which methods can one use to manage it? Let's find out in today's video. But first, before we go on, a sub to the channel would be very appreciated. Comment, share the video with your friends, and don't forget to leave a thumbs up for the video. So, let's get into it. What exactly is it, and what causes it? PCOS is a group of symptoms associated with hormonal imbalance that can affect women and girls of reproductive age. Since we've used the term hormone in our description, it is a good idea to define and clarify what they are. These are chemical elements found in our bodies that ensure messages are delivered to target organs via the bloodstream. They are in charge of a variety of bodily activities, including growth, sexual function, reproduction, and so on. When PCOS develops, the body's two hormones, insulin and androgens, are out of balance. Increased insulin levels in the body are considered to cause the ovaries to work differently, resulting in excessive quantities of male-type hormones, or androgens, which underlie many of the symptoms of PCOS. PCOS is caused by increased amounts of these hormones. One of the most significant and common effects is that it causes or leads to the lack of ovulation, resulting in irregular menstrual periods or perhaps no periods at all. Another common sign of this condition is that the woman or girl has excessive body and facial hair. What exactly do the ovaries do when this illness affects them? To begin with, ovaries are small oval-shaped structures that are found in the pelvis. Their primary responsibility is to help women in becoming pregnant. The eggs do not fully mature in women with PCOS. This is the common reason for infertility problems. An ultrasound examination of the ovaries in some women with PCOS will reveal several follicles in the ovaries. These are not cysts, but partially produced eggs within the ovaries that haven't developed fully. Increased levels of male-type hormones in the body are to blame. It's important to emphasize that there's no known link between these follicles or underdeveloped eggs in PCOS women's ovaries and a larger genuine ovarian cyst, which may require surgery, or the risk of ovarian cancer. With this in mind, even if you think you're in good health, it's a good idea to get regular checkups. If this problem is discovered in its early stages, it could save you a lot of money or perhaps your life. So, how often do you go for checkups even if you aren't experiencing any problems? Comment below. Let's engage! I'm sure you're asking if there are other causes for this ailment besides hormone imbalance. Yes, even more. Shocking is the fact that some of these factors are largely due to lifestyle choices. Body weight is another factor. Women with PCOS, on the other hand, are more likely to be overweight or obese. Insulin resistance, which is regarded to be a significant aspect of the development of PCOS and the symptoms of PCOS, is worsened by being overweight. Excess weight raises both of the hormones that cause PCOS symptoms. The good news is that a balanced diet and regular physical activity can help treat PCOS and alleviate its symptoms. Support is available to assist you in making lifestyle changes that will improve your overall health, including numerous PCOS symptoms. This disease can be handed on through the generations through genetics and trait inheritance. PCOS has yet to be linked to a single gene, implying that the link is likely to be complicated and involve numerous genes. Women with PCOS are 50% more likely to have a female family with PCOS, such as a mother, aunt, sister, or daughter. In families with PCOS, type 2 diabetes is also common. Now that the causes have been established, what are the signs and symptoms of this condition? Symptoms can appear in a variety of ways. Some women will experience only a few or minor symptoms, while others will experience a variety of severe symptoms. Symptoms can also change as a woman's life progresses. These symptoms are: Number 1. Mental and emotional health. This disease and self-esteem are the topics of today's video. Let's take a look at how the two are connected, as well as what the victim goes through. Accompanying this condition are mood swings, depression, anxiety, and self-esteem issues. Body image, self-esteem, sexuality, and femininity can all be affected by hirsutism, severe acne, weight changes, and fertility issues. This can exacerbate despair and anxiety. Fertility issues can affect your mood, especially if they have been a source of anxiety for a long period. Furthermore, if you are uninformed that you have PCOS, these emotional issues might be even tougher. A delayed diagnosis of PCOS, as well as weight management issues, can leave you feeling defeated and powerless. People with PCOS are stigmatized and misunderstood for being difficult to deal with, irritable, and non-participative. They are sometimes misunderstood even by their relatives and family. Intimate relationships can be difficult due to the increased testosterone that plays with the sex drive, causing it to sag, become non-existent, or go into overdrive. Because of shame and self-consciousness, the extra weight gain and undesirable hair have a negative impact on intimacy. Education is essential for both the patient and their loved ones to understand why someone with PCOS may appear irritable all of the time. The emotional difficulties of PCOS can be tough to deal with, but with the right support, education about PCOS, and treatment, your emotional and physical health can be improved. Girls who suspect or have PCOS are encouraged to ask themselves these basic questions to take control of their mental health. Do I feel down, low, depressed, or hopeless? Have I lost interest in or pleasure from activities that I used to enjoy? Do I give much thought to how I look? Do my eating habits make me feel guilty, depressed, or disgusted? If you answered yes to any of these questions, you must get medical advice. Each woman's PCOS experience is unique, and it will evolve throughout her life. It's critical that your treatment is highly individualized to match your unique demands at any given time. There are numerous therapies available for a variety of emotional health issues. Some women may benefit from a few sessions of counseling, while others may benefit from the continual support of counseling. Number 2. Related health conditions. Weight gain or obesity, insulin resistance, if they don't already have it, type 2 diabetes, cholesterol, and blood fat irregularities, cardiovascular illness, heart disease, heart attacks and stroke, endometrial carcinoma, cancer, and sleep apnea appear to be at a higher risk for PCOS victims. Other effects, which are modest in today's video environment, are also present. During ovulation, there are irregular periods and the release of immature eggs. The appearance of pimples on the skin is another. To sum it up, I'd want to discuss the various types of health providers who may be useful in the rehabilitation process. Gynecologists can treat women with PCOS who have irregular menstrual periods. For your hormonal imbalance, you'd also see a medical endocrinologist, because one of the side effects of this ailment is that it affects the skin. It goes without saying that you should see a dermatologist to have your skin examined. You might also want to see a psychiatrist or a psychologist about the mental impacts of PCOS. They will assist you in dealing with your anxiety and despair till your life returns to normal. Finally, you'd want to make an appointment with a nutritionist. If food and lifestyle adjustments are not made, PCOS can lead to major consequences such as high cholesterol, high blood pressure, type 2 diabetes, and heart disease. Dietitians can help you with these nutrition and lifestyle strategies, which are an important component of your long-term treatment plan for PCOS. And that's all for today's video. Thanks for watching. Did you like the video? What did you learn? Comment below. Let's engage! Remember to subscribe and switch on the notifications bell if you haven't already. Like, comment, and share this video. Goodbye friends, see you in the next video.